everybody, Dr. Daniel, and today I'm talking about, do occipital nerve blocks help migraine? Migraine is a trigeminal nerve cerebral arterial problem with inflammation of the trigeminal nerve and the cerebral arteries. The migraine process produces the neurochemicals CGRP, neurokinin A, and substance P, which cause the inflammation. The nucleus caudalis in the brainstem is also activated by the migraine process, and its fibers go to the back of the head on one side in the C2 distribution. C2 fibers go into the occipital nerve. Persons with chronic migraine, which is defined as at least 15 headache days a month, 8 of which have migraine features, commonly have pain in the back of their neck or head due to stimulation of the C2 fibers. A person with episodic migraine may have a headache that starts in the back of the head or neck on one side and then comes forward to behind the eye or the temple on the same side of the head. So, do occipital nerve blocks help migraine? Occipital nerve blocks have a long, successful history of helping migraine patients. Steroids and/or local anesthetics are injected near the greater and lesser occipital nerves in the back of the head. The injection blocks pain signals and reduces swelling and inflammation in the back of the head and neck, and is helpful for treating chronic migraine headaches in this area. Related questions. What are the indications for the injection? Well, occipital neuralgia, migraine, which hasn't responded to conservative treatment, post-lumbar puncture headache, cluster headache, and cervicogenic headache. Where is the injection given? The patient is conscious during the procedure. The doctor uses a 26 or 27 small gauge needle attached to a 5 cc syringe and injects in the back of the head at the level of the ears, about halfway from the center of the back of the head on one side. Specifically, the injection is given at points of the greater and lesser occipital nerves down to the periosteum of the occiput. The occipital nerve is between 8 to 18 millimeters deep. The injection is usually given on the side of worst patient complaint of headache, but it will work if given on either side, and it will also work for patients with pain on both sides of the back of their head. What's injected? The doctor injects cortisone for anti-inflammatory effects such as methylprednisolone or triamcinolone, and long-acting local anesthetics such as lidocaine or bupivacaine. Studies have been done comparing clinical results using only a local anesthetic alone and a local anesthetic plus a cortisone drug, and both drugs seem to work equally well. What about patient allergy to cortisone injection? All patients should be queried regarding allergic reaction to cortisone drugs. Cortisone allergic patients should not be treated. Where is this treatment performed? The injection is usually given in an exam or treatment room in the doctor's office. It's not a big deal, and the side effects, which will be discussed later, are few and mild. Usually a small injection of one of the anesthetics is given first, and the doctor will wait about 5 minutes for the medicine to work, and the numb spot where the full injection will later be given. There's usually no blood loss and no need to use a Band-Aid or dressing. The patient may sit up or lie down on one side for the injection. How long does the procedure take? This is a simple, quick outpatient procedure, much like a dental injection of lidocaine during dental work, and just takes minutes. How long before resumption of normal activities? After the procedure, the patient is not usually observed in the office, and they may leave and have no problems driving themselves home and performing normal activities thereafter. How long does the injection take? The injection is usually very quick, 15 minutes or so to do the whole thing. What are the results of occipital nerve blocks? A recent study found that 80% of patients experience significant or moderate decrease in pain. Long-term statistical studies are needed, but the general experience in neurology and headache work is that these blocks are usually effective. A second injection may be given to patients who respond well initially. This is usually done or offered several weeks after the first injection. How long do the effects of the nerve blocks last? It's normal to have numbness at the local scalp injection site, since local anesthetics produce this. The numbness is like that which occurs with dental procedures. The duration of numbness is usually 3 to 4 hours. Beneficial effect from the steroid takes 3 to 5 days. Pain reduction may last days to weeks or occasionally several months. What are the side effects of an occipital nerve block? The most common side effect is injection site pain, which is short-lived. Other side effects include temporary, 6 to 8 hour symptoms of bleeding, dizziness, weakness, and lightheadedness. There's a slight risk of infection. So, thanks for listening to this talk about occipital nerve injection for bad, severe migraine. Please click on the subscribe down there. God bless all you folks with migraine who've had one of these shots. And I'll see you again on my next talk.